Good morning, everybody. I'm Carol Lynn here with Los Angeles County, and joining me today is Dr. Jeff Gunzenhauser. He is the Chief Medical Officer at Los Angeles County Public Health, and we're here to talk about a very important topic, that is your health. It is flu season. It's a tough season, and we want to get it from the expert in terms of what you can do to stay healthy. Welcome, Doctor.
My pleasure to be here. Thank you, Carol.
So what kind of flu strain are we looking at this year?
This year's an unusual year because the strain that started the season this year is influenza B, and normally influenza B doesn't show up till the end of the season. It's very unusual. The other part that's very unusual this year is that the season started very early. It started in the second week of September. Usually it starts late October or November. So those two things have made this season very different from the past seasons.
Is this a dangerous strain of the flu? Because it's been making headlines, I believe. People are dying, especially young people.
One thing that's important to realize is that all influenza can cause very serious infections. All strains end up killing people, unfortunately. Influenza B this year is a little bit unusual in that for some reason, older folks, who normally are the ones most at risk of dying or having severe infection, seem to be protected. It could be that a couple of decades ago or something, a similar virus circulated, and as a result, they're immune. So with the influenza B that was circulating into the fall and up till recently, it's mostly affected younger people. So when you hear in the news, you'll hear that there was a child who died in Riverside County back in September, and it does seem like quite a few younger people have been affected. But what we do know is that the rates of infection are extremely high. As of a few weeks ago, 10% of all emergency department visits in LA County were attributable to flu-like illness. That's a very high level. So when you talk with people, with friends, you're going to find many people are saying, oh yeah, I had that cough, that sore throat that went into my lungs and I didn't feel well for a couple of weeks. And many people are experiencing that.
What are the typical symptoms this flu season?
Flu usually begins with a feeling of not feeling well. You just kind of feel sick, you've got the blahs. Then you can get a fever. Sometimes it's low, might be 101. Some people can go very high. Then eventually most people get a cough. They may have a runny nose and a sore throat. Then for many people it eventually will affect the lungs. They could get like an inflammatory reaction and they can get a cough that commonly can persist up to 5 or 7 days. In some people that cough can persist for weeks. So you'll often have somebody that you know who got sick, they got over it, but they're continuing to cough, and that's not uncommon for flu. In certain people, particularly older people over 65, children, especially if they're under the age of 2, pregnant women, or anyone who's got a lung issue like asthma, if they have a heart condition or even a kidney condition, is at risk of more serious complications because their heart could fail, their lungs could fail. In a woman who's pregnant, there's a lot going on physiologically that puts her and her baby at risk. So it's really important that all those people get vaccinated before the flu season comes and they're protected against that.
All right, so is that the best form of prevention at this point, is get that flu shot? Yes,
that's absolutely the best thing to do. The flu vaccine is very effective. The strain of the vaccine that's showing up now is H1N1. It's very similar to what circulated 10 years ago when we had the pandemic. And it turns out that the strain of vaccine in the flu vaccine is the exact match of the virus that's circulating.
They got it right.
So they got it right. So if people still haven't gotten the flu shot, it's probably going to be around for at least a couple of months. There's plenty of opportunity to get vaccinated against that particular strain.
Where should they go to get the flu shot? Do they have to go to their doctor? Can they just go to the drugstore pharmacist? Is it the same vaccination?
It is the same vaccine. There's a number of manufacturers, but they all have the same components in it. It's very convenient now. There are many signs for these pharmacies. You can just walk in. When they find out what health plan you're a part of, they can bill it, and you can be in and out of there in a few minutes. So for people who are at risk or anybody who hasn't gotten vaccinated, I recommend they go take care of that today if possible.
I got mine at my doctor's, and it was billed to the insurance, but then I went to my pharmacist, and they were giving out free ice cream. So I missed out on the free ice cream. Nevertheless, I did get my flu shot, and I feel pretty good. So it's not too late, but it doesn't immediately inoculate you, right? Isn't there a lag time, about a few weeks or a month?
Yeah, that's correct. It takes the body anywhere from 10 to 14 days to build up full immunity. Sometimes it's a little bit shorter than that, but generally we say 2 weeks. You should feel that you're protected by the end of 2 weeks. So if you get vaccinated today and you get exposed tomorrow, it may not protect you, but it might protect you in the middle of next week. So the sooner you get it, the better.
When, let's say I have the symptoms, may or may not have gotten the flu shot, how do I know when I'm headed towards an emergency and I need to go to the emergency room or I need to see my doctor right away?
Well, there's a group of people who I think should plan for that well in advance. So people who are elderly, people who maybe have a child, someone who has a pre-existing heart condition or has asthma or some lung condition, they should be prepared to receive antivirals as soon as possible. You don't want to wait till you diagnose it's the flu. It's as soon as you don't feel well, as soon as you have a cough, as soon as you have a sore throat, assume that it's the flu. Immediately call your provider and say, I need those antiviral medications. And most providers can, over the phone, give you a prescription and you can go the same day and pick up those medications. If you wait more than a couple of days to start those drugs, they won't help you. But if you start them on the first day, it'll shorten the length of the illness and will reduce the severity of the symptoms. For most other people, they can get antivirals as well. They will help anyone, so it's good to talk about that with your provider. But for other folks who just want to take care of themselves, often they can just stay home, get some rest, drink fluids, maybe take some acetaminophen for fever control and for pain. If they get to the point where they have high fever, let's say it's 103, 104 or something that's persisting for more than a day, they have a really bad cough, any kind of symptoms that are unusual, I would say they should call their provider and go in and get seen.
Okay. What are you doing to stay healthy these days?
Well, exercise is very good, lots of nutrition, and get lots of rest. I think during the winter season, if you do those things, it strengthens your natural immunity, so you're less likely to catch any kind of infection. But also, these things are transmitted from person to person, so if you do get ill, if you have a child in the family, or if you have a spouse, encourage them to stay home so they don't infect other people. And of course, if you cough, cover your cough with a tissue or your sleeve, and certainly wash your hands so you're not picking up germs from other people.
You bet. Terrific tips. I know we gave a lot of information. We want to make sure that you have a resource to go to just in case you want to catch up on this conversation. We're going to probably post this link on Facebook so that you can rewatch the interview. But in the meantime, does Public Health have a resource that folks can go to in case they want more information about flu season?
Yes, on our website, which is publichealth.lacounty.gov, if you just go to that website, or you could just Google LA County Public Health, go to our website. On the banner, it talks about influenza. So click on that banner and it'll take you to the links that provide all this information I've shared today.
Great. I feel like I've had a checkup. Thank you very much, Dr. Gunzenhauser. Really a pleasure to have you. Chief Medical Officer here at LA County Public Health. So we want you to stay healthy, get that flu shot, take care of yourselves, and we'll see you next time.